Yes, my people, my people, my people. A very good day, a nice day today. Very nice day. Good morning, good evening, good midday, depending with where you are. You remember today we are supposed to start on a topic on a certain to continue on a topic, not to start. We are supposed to continue on a very important topic. A very important topic that is called management of hypertensive disorders. Management of hypertensive disorders. How we manage hypertension. Yesterday we talked about several things in hypertension. And the things with Doreen Small is here. Good morning from Jamaica. I will say good morning, and here it is good evening, Doreen Small. Good evening. We are continuing with the topic that we started yesterday. The topic was management of hypertension and hypertensive disorders. I explained how hypertension is and how hypertension comes around. A minute, but no, I explained how hypertension comes, what causes hypertension. When you are stressed, what causes hypertension? And then we learned about secondary and primary hypertension. You remember that? Secondary and primary hypertension. I'm just going through the things we learned. You remember about sympathetic nervous system, activation of sympathetic nervous system, eh? Part of the autonomic nervous system, how vasoconstriction happens, how your heart rate goes up, how renin from your kidneys are released. You remember that? That was one of the effects of the hypertension. And mostly when people are stressed, you remember I said the sympathetic nervous system takes over. That's why most people, when they are stressed or they are running or they are excited, you find their system, their blood pressure going up. And you remember how we talked about the blood pressure? The blood pressure is measured as systolic and diastolic. And we said the systolic one is when the heart muscles are contracting, but the diastolic one is when the heart muscles are at rest. The lower one. So we said about activation of renin and angiotensin system, how renin comes from the kidney and it excites your aldosterone from your brain. And aldosterone, because we call it water hormone, it takes water inside the veins and the arteries. And then how do you behave? Your pressure goes up. That was the second one. I'm just reminding us ourselves of what we went through yesterday so that we can start having a good conversation when it comes to treatment and management of hypertension. Yeah, because everyone has problems with hypertension, one or two. So we went through the normal. Marge in the house. Marge, welcome. We are talking about how to manage hypertension. And I'm just explaining and reminding ourselves about what we did yesterday. It's very important when we know and we learn, so that you can help someone out there. You know. So we learned about these things so that we can help someone else. And then we went to impaired sodium and water excretion. When the kidney fails to remove sodium, today I'll teach about the kidney, the function, then I go to management so that you'll know how to balance. Please, as you come in, like the video. Let's feel good when we are listening to how our body works. Share, tell a person that this doctor is teaching us how to manage our stresses and hypertension. It's very important. It makes someone feel good. At least I'm helping. Even if I help one or two lives, you see, that is an achievement. By just talking to you out there, I'm trying to help one person. Saving a life is very important, and that's why I am live to save lives. You see, yes, we continue with the fourth, the problems with the inner endothelial damage. The problem with endothelial damage. Let me find where my papers are. The endothelial damage. Yesterday we talked about. You remember our heart, our muscles, our veins, there, our heart, veins and muscles. These are them. And then we talked about the normal blood pressure. Low, more, less than 120, 80, 120 to 129, less than 80. You remember our talk yesterday? So fruitful. People appreciated. We talked. Some people that were having problems, they did what? They felt good. They were not worried. But today, we will know there are some cases of hypertension that can be treated. You see, some cases of hypertension can be treated, which is very important. Please like the video. Say, just push the button and say, Dr. Ben, I like this. I feel nice in my heart that I'm helping. Now we continue. Endothelial dysfunction. You remember endothelial? I say endothelial. Inside these veins, there is a lining called endothelium. So it produces something called nitric oxide. Nitric oxide it works as a muscle relaxer. You remember? And endothelin, it produces the cells inside produces something called endothelin. It is a vasoconstrictor. A vasoconstrictor. So we are continuing to learn vascular remodeling after an injury, genetic and environmental factors. We talked about genetic and environmental factors. Very important things we learn here. Very important. So today I want to talk about the kidney first. The kidney, before we go to management, because the kidney relies on the kidney itself relies, the management of hypertension mostly relies on the kidney. You see, so we really need to know how the kidney works. I will draw my kidney here. Don't worry, very soon we will be having a studio, a very nice studio, whereby this studio we will not be having a problem. I'll just be showing them here a board so that people may understand well and have. But for now, just understand. Let me draw my one kidney here. A kidney looks like a bean. Bean, you see, a kidney looks like a bean. One of the bean. Bean. If you have a question, my friends, let's learn. Let's learn. Look at my kidney. This is my kidney. Now, the kidney has small filtering. You see, this is a kidney. For me, I've drawn a kidney. So there is veins that blood comes in here. Please don't just watch, like the video, please. This is my kidney. Let me write here kidney, so that people may see and they will not. So here is where the blood comes in. Blood comes in from here. So I will mark the blood with red so that we understand where. We learn about the kidney, and then we go to management, because management of hypertension mostly relies on the kidney. It is very important to learn how the kidney works so that you may know. And if you look well, most people with kidney problems have hypertension. Now let's check it out. Blood comes in, blood comes in, blood comes in from here. And then when blood comes in from here, it goes to some very small filters here. You get it? So the filters, let me draw. I need another paper here. I need another paper here to draw. I want everyone to understand how the kidney filters your blood. Filters. So this is the loop of Henle. There is something called the loop of Henle. The loop of Henle from the kidney. The loop of Henle. You see now. Very nice, my friends. Let's learn how our bodies work so that we may know how to manage our bodies out there. So this is the kidney. My kidney is here, a very funny one. So blood comes in from here. You see, it enters here. So these spirals are these ones. These spirals are these ones. So this is it is called the loop of Henle. So when blood comes in, let me draw, and I hope you are seeing me nicely. So when blood comes in, these are porous. Blood goes as it is pushed. So as it is pushed, these are blood capillaries. These are blood capillaries that are here. They absorb. They take glucose. They take another thing that is supposed to be taken inside your body is protein. Proteins are not supposed to come out of your body. Sodium is supposed to go in your body so that it can take water out. You see? So these are two. This is the kidney here. And the small round things, that you are seeing is this. The small. So when blood comes in, like I've noted here, when blood comes in here from this side, it goes to these small pipes. So what happens inside these small pipes? As the blood flows, as the pressure, you see, this one, where the blood enters, let's say the blood enters from this side. Where the blood enters, it is bigger than where the blood goes out. So it causes pressure inside here. And if it causes pressure, it means because this thing has holes, some of the fluid will come out. And if the fluid come out, what will happen? There is something here that will be waiting to take. So your urine is produced and it goes down to the bladder. It is funny, but at least I'm explaining something for someone to understand. Listen, the kidney, this is where blood comes in. These are the small loop of Henle's, but now the small loop of Henle's look like this. You get it? So blood comes in here. This is bigger than this. So when it is here, it causes pressure. And then some fluid starts to come out. So as it comes out, these blood capillaries that are like this, they absorb the glucose that the body needs. They absorb the sodium that the body needs. They absorb, if any protein is going out, it goes inside the body. You get it? It goes inside the body. So this happens. When it goes inside the body, these small capillaries, they take back the blood. They take back the blood to the body. You get it? This is how. Let me repeat. Please, if anyone is not understanding, please ask that question. This is very important when it comes to management of the kidney, of the hypertension. This is my kidney, the bean. So blood comes in from here and it goes out from here. And then there is something that takes urine down. You get it? Now, when blood goes in to these small filters, these filters look like this one. The filters, this side is bigger and this side is small. So it causes tension around here. So what happens if this is bigger and this is small? Some fluid will start coming out. But remember, there is this capillary that is filtering here, here. It is absorbing. If fluid comes out with glucose, this capillary takes the glucose, returns it back to the bloodstream. If sodium comes out, it goes back. That's why when you are sick, and then you go, and then you are told, we will do kidney function. We want to know how your kidney works. They do sodium, they check chloride ions, they check potassium. They want to know how much potassium is going to the urine, how much potassium is coming to the urine, so that they can know this kidney is impaired. This kidney is not working correct, because we don't expect a lot of sodium in urine. You say that is what we usually look at. Hmm? Hope I'm explaining in a layman's language so that anyone can understand. Hmm? So, if they do take the measurements and they see maybe sodium is high, it means our loop of Henle here, it means what? Whatever that is supposed to be absorbed, it is absorbed enough, and excess that is coming out is too high. The kidney has injury, so it is not performing well. You get it? So in the urine, you will find even glucose. And you know one thing, in urine, you should not find glucose. You should not find glucose in urine. Why? Because all the glucose is when the blood just comes in and starts getting the excess fluid getting out, glucose is taken back to the body. Another thing that is taken back to the body, sodium is taken back to the body. So this is where aldosterone comes in the vessel. You remember how we talked about the aldosterone from your brain? If it is released, all the sodium that is penetrating out is taken by this spiral thing back to the body, so that it can take more fluids inside. You get it? So when you are told, my friend, you go to hospital and then you are told you are sick and we need to know how your kidney functions, they want just to know how your kidney is absorbing glucose, your kidney is filtering out, and there is something very important called creatinine. Hmm? Have you ever heard about creatinine? What is creatinine? Hmm? That the kidney should remove from the body. Creatinine, my sister, this is a toxin and is a waste product. A toxin and it's a waste product. So creatinine is a waste product formed from the abnormal breakdown of phosphate in muscle metabolism. You get it? Your muscles, when they are undergoing work and some cells of the muscles are destroyed, this thing called creatinine comes out. It is filtered out of the body by the kidney and excreted in urine. The same way I've told you. So it is when it is in blood, it is removed from this loop of Henle. The creatinine is removed from the loop of Henle. You get it? So when your muscles are breaking down and rejuvenating and producing more, the creatinine is produced. You get it? Normal levels in blood is 0.7 to 1.3. Imagine 0.7 to 1.3. So when you find you have high creatinine levels in your blood, your kidneys are not functioning well. So as you grow, as you work, as you do your daily chores, know that your body is producing more cells. That's why you look nice. That's why my skin looks like this. That's why inside me I'm functioning. That's why. But you see, the problem is there are some cells inside my body that break down and they should be removed. You see, so they produce this breakdown of this creatinine. creatinine phosphate, muscle in muscle metabolism. You get it. So, what is the clinical significance? What is the significance of creatinine? High creatinine levels may indicate acute or kidney injury because the kidney is not removing the creatinine well. Hmm? Dehydration. When you are dehydrated and you don't have enough fluids in your body, it will lead you to not to remove the creatinine well because kidney relies on enough fluid from the veins so that it can function well. That's why when you have low blood pressure because of volume of fluid or of some fluids in your body, what happens? You have a kidney injury because it will now start suffering. It is not having good perfusion. Eh? And then we know when someone is so thin, trying to eat, trying to do everything, but this person is not getting weight. We'll know when we do kidney function test, we know that there is a problem with muscle breakdown. This person has a problem. Have you ever met someone who is so thin? This person tries to eat. Hmm? Eh, please like the video as I talk. Let's share ideas. Let's talk. Let's like and share. Let's help people. Now, when the person eats but is not gaining weight, but when you do the kidney function, you find high creatinine levels. It is called rhabdomyolysis breakdown. When you hear anything lysis, rhabdomyolysis, rhabdomyolysis, anything lysis means breakdown. So that one is one of it. We need to take care of. We find out why this person is breaking down proteins always. Urinary tract obstruction, especially for men. If you have prostate hyperplasia, hyperplasia is a cancer. Prostate swelling, you get it. It obstructs urine from the urinary bladder up to the bladder, then urine piles, it goes up to the kidneys. Then you cannot filter well. We know what is happening. This person is having obstruction. We go and put a catheter. That topic will come, catheterization and mental health. It will come. And then low creatinine levels occurs in muscle wasting, pregnancy, because now the baby is in the stomach and you are sharing food with the mother, you'll find most of them having low creatinine levels. Now, have I explained at least how the kidney works? I think I've done a good job. Let me repeat faster, then we start management of hypertension. We have our kidney here, a very nice big bean, a very nice big bean here. Blood comes in from here, and then it goes to these things that I've drawn here. Very many things. They are called nephrons. But in the nephrons, we have this. These structures are very many and small like this. So this is where blood comes in. This side is big. We call it afferent and efferent tubules. So in this side is big, this side is small. So when blood comes in, the tension here becomes high. So if the tension becomes high, what happens? Fluid comes out. Fluid comes out. But capillaries, they start to absorb the glucose, the sodium. You see, some goes, the proteins go. Protein never comes out of blood capillaries. They are big molecules. And proteins help when it comes to oncotic pressure, fluid pressure inside the blood vessels. So one day, if you go and take urine to a laboratory, and then they tell you have protein in your urine, my friend, you just know you have kidney problems. Proteins in urine means kidney injury. Yes, I've explained that. Now, how can we manage a person with this relevance of this? What I'm explaining will come. How can we manage a person who has kidney injury? How? Hmm? We call it A, B, C, D. Where is my papers? I really need a board, my people. I really need a board. The studio should be up and running. I really need a board, my people, so that we can be explaining, drawing, and relating. Now, this is it. We call it A, B, C, D. Hmm? A, B, C, D. How we manage hypertension. So this ABCD is called angiotensin converting agents, beta blockers, calcium channel blockers, diuretics. I will come there and we see how we can manage. If someone is seeing a bit deep into medical terms and is complicated and you are not understanding, please raise your hand. Call me, tell me, repeat. I want to understand. I think I'm really doing a good job when it comes to at least everyone to understand what I'm really trying to push so that people should know. Now, students, even students, it will help students when they really understand how this, sometimes teachers go teach students and they don't even get it. And they will cram and they will pass exams. Cramming and passing exams is a disaster when it comes to medicine. You should understand. And people cram and pass exams, my friend, dangerous. If you meet that doctor, dangerous. Now, we continue. We continue very well. We continue. We said hypertension management starts from your mind. Starts from your mind. Management of hypertension involves lifestyle modification, pharmacological treatment, and regular monitoring. You see, because we saw somewhere that someone is having stress, and continued stress leads to sympathetic nervous system activation. You remember that? And sympathetic nervous system releases what? Adrenaline, fight and fright hormone. So if that hormone is released in your kidneys, what happens? Renin is released. What do renin do? It tells something that is roaming around your blood vessels, roaming around your blood vessels. This thing is called what? Angiotensinogen. So angiotensinogen says what? Hey, I cannot work alone. I need something to convert me to angiotensin 1 so that I can work. So angiotensinogen converting enzyme comes in, hugs angiotensinogen. When it hugs angiotensinogen, what happens? It is converted from angiotensin 1 to 2, because when you are 2, feeling good, produce a baby. Now, the angiotensin 2, what does it do? It activates your brain aldosterone to be released. And remember, angiotensin 2 is a vasoconstrictor. It constricts the arteries and the veins so that pressure can be high. And aldosterone retains fluid inside the water, inside the veins, by doing what? Retaining sodium. Just imagine, if sodium is in your veins, more fluid comes in. What happens to your pressure? It goes up, 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 up. Very interesting, eh? Very interesting when we are learning about medical, how our bodies work. So, what happens here? Lifestyle modification. Stress. You see how stress comes in? How stress makes you to have pressure. You see how stress makes someone. You've heard a person telling someone, please don't bring me, my pressures will go up. Because when this person is irritated, sympathetic nervous system comes in, pop, renin is released from your kidney. So when you know you are that kind of person, what happens? Cognitive therapy comes in. This person should be talked to. This person should know anger management. This person, because now you will be excited, anger will go up, sympathetic nervous system will not be sleeping in your body. It will awake like a monster and release renin from your kidney. Yes. So this person should be talked to. If it is not enough, this person should see a counselor. This person should understand when you are hungry, your problem is your kidney releases renin very faster. And renin finds where angiotensinogen is. And you know, after angiotensinogen, we go up to angiotensinogen 2 to aldosterone, your pressure goes up. So anger management is very important for this person so that we cannot get a person dying from heart attack. Because imagine you are just well, someone angers you or excites you, your renin is released because you have a problem of renin being released faster, and then aldosterone is released impulsive. Pah! Your heart rate goes up, your BP beats up, you can have an heart attack and your vessels may break down. So therapy is important for this person. Anger control, very important. Excitement control. You have seen people who laugh until they cannot laugh, they start doing excitement. Now you know how those people suffer. When they laugh, they start crying, and then they start, this person just died while happy. Hey, it's not he died while happy. The excitement of sympathetic nervous system took control, and this person had a weak kidney release of renin, and it took over up to the aldosterone. You get it? So we don't say he had a problem, he had no problem, he did not know how to function or how to behave when it comes to anger management or excitement problems. Now, that is one. Two, lifestyle modification. Yes, you saw yesterday we talked about a lot of carbs and cholesterol can cause your veins to be tough. Tough, because when cholesterol is piled in your vein, many cholesterols, this board, my friend, this board, when will it come? I really like drawing and explaining. Where is my, now, this is, where is that paper? Yeah, yeah. Yes, I found it. You see, this is our veins. And then, where is my red pen? Yes, here. Cholesterol pile in your veins. Cholesterol pile in your veins. What will happen? Blood flow here will be restricted. Blood flow from this side will be restricted. And then your veins will become tough. So you will suffer from two things. Atherosclerosis, one, sedimentation of cholesterol in your veins. Two, you will suffer something called arteriosclerosis, hardening of your veins, because they have been restricted from relaxing and contracting. Arteriosclerosis, hardening of your veins, and atherosclerosis, atheroma. Atheroma means sedimentation inside your veins. So what happens? Blood pressure goes high because now your heart will be doing so much work to pump blood inside the thick blood, which is filled of cholesterol, plus one thing, the filled up veins and arteries. You see, most of them are emergencies. That's where you are given drugs like statins that can liquidify the cholesterol. You see, we are going very slow, very nice, my people, very well, and we are learning. If you have a question, Just break it down. We continue. Hmm? We have started in how your mental capacity can make you to die because of high pressure, or how your stress can make you to suffer from pressures. You can avoid antihypertensives, my friend. You can avoid antihypertensives by listening to me closely and slowly. Hmm? We have said when it comes to stress issues, what do we do? Psychotherapy and therapies. Talking, accepting what is, someone can lose a job and this person starts to have hypertension. Hmm? Now, you have eaten, money is there, sedentary lifestyle. Today is KFC, tomorrow is a big barbecue with more carbs. You are eating a lot of soda and alcohol. You are drinking like nothing else because you suffered while you are not having a job. But now you have the job and it's well-paying job. Now what happens? The carbs are turned to cholesterol. Sedimentation in your body increases of cholesterol. Your body becomes big. So metabolism is increased. When metabolism is increased in your body, what happens? The insulin that you are having in your body that is being released, hmm, cannot be enough to change the sugars that you are giving your body to glucagon, hmm, insulin. We talked about insulin yesterday. Hmm? It is produced from the isolates of Langerhans, beta cells in the pancreas. Insulin produces the isolates of Langerhans. Insulin is a peptide hormone, produced by the beta cells of the isolates of Langerhans in the pancreas, and it plays critical role in glucose metabolism so that it can lower your blood glucose level so that you cannot get something called ketoacidosis. Acidosis because of glucose. So what happens here? It changes glucose, increases functions of insulin. I want to go very slowly so that we understand how insulin comes in with hypertension. On carbohydrates, increases glucose uptake to cells, especially muscles and fats. It makes your muscles take more glucose for you to get injured, energy, energy. Stimulates glycogen synthesis in the liver and muscles. Glycogen synthesis. Glycogen is a store whereby when you don't have enough glucose, you will use it. You get it? It is stored in the liver, this glycogen. Hmm? And even in the muscle, some glycogens are so that when you have not eaten the whole day, you cannot fall down. You will use this glycogen. Hmm? Inhibits gluconeogenesis, glucose production from non-carbs. It makes when you take proteins, you don't start to form glucose from proteins or cholesterols. And on proteins, it stimulates protein synthesis in the body. It makes you have more proteins. You get it? Inhibits protein breakdown because proteins are bodybuilding. So if you break down your proteins in your body, you will be cachexia. Cachexia is a term we use in medicine to say this person is so thin. You get it, my brothers and sisters. Hmm? On fats, promotes liponeogenesis, fat storage. So when you have enough insulin, you will have enough fat storage. And fats help you not to feel cold, very many things, to be hydrated so that you cannot have skin that is cracking every time. You see, on potassium, what do insulin do? It drives potassium into cells, lowering potassium level. Hmm? So when insulin is low, what happens? It activates sympathetic nervous system so that Your muscles can produce glucose without insulin. You get it? Very clear. And you understand what sympathetic nervous system do. It raises the pressure. I've explained how it works. Hmm? So when you have a big body, you are eating carbs, eating without dieting, you become someone that doesn't have enough insulin because your body was small. Now insulin needs to be more to break down whatever I've said. It means sympathetic nervous system should be activated so that some glycogen that are stored in your muscles can be released to help you get glucose. And that's where you get very high glucose that cannot be tolerated plus hypertension now because sympathetic nervous system is on work and now you don't have enough insulin. So working out and going to the gym is very important. Very important, my friends. You listen, very important. It stimulates even insulin release. So I've talked about insulin and big body mechanism in hypertension. That is lifestyle modification, management. You get it? We are in management. Hmm? Monitoring always. When you feel sick, you monitor your glucose. You see, you monitor your glucose. And then there is something called acute kidney injury and chronic kidney injury. Now, when someone has taken alcohol or some drugs, they injure the kidney, you can be cured, and then what happens? You start living a normal life. You start the kidney is healed. Mainly you have something called pyelonephritis because of infection. You will be treated with antibiotics, and then with time you will stop taking the medicine for pressures because now the kidney will come back and start working on well. You get it? Maybe you have thyroid problems and salt regulation is a problem. Then you go to a doctor, diagnoses you, treats the thyroid, and then you stop taking the medication now because now the thyroid has started working well. But there are some things we should know in lifestyle modification. Weight loss, very important. If you are above 90 kilograms, 90 kgs. We in our country we use kgs, kilograms. In other countries they use pounds. Pounds. We are above 150 pounds. Hmm? You should know how to manage it. And then dash diet. There is something called dash diet. Low salt, rich in fruits and veggies. You know, veggies help so much because even the kidney helps in producing red blood cells. So when someone is anemic and he has a kidney injury, know that the kidney is injured, so it is not producing a hormone called erythropoietin. Erythropoietin activates the creation of red blood cells. So when you take DASH diet, low salt, rich in fruits and veggies, you are helping yourself and the kidney to create these things. Hmm? Reduce salt intake at least 6 grams per day. But salt in food, don't put it so much, just a little for taste. But you see, there are some people do a lot of salt because now, if you put a lot of salt in food, you are taking in a lot of sodium. And you've seen aldosterone plus the sympathetic nervous system, they rely on salt to make your pressure go up when you have a breakdown of sympathetic nervous system or something has excited you. Limit alcohol. Hmm? How do alcohol injure the kidney? We talked about it somewhere, you remember. Destroys the nephrites and it makes you, let me repeat that. Hmm? Alcohol injury to the kidney. Very important. Some people take alcohol, but they don't know they are harming themselves. Chronic and excessive alcohol can harm kidneys both direct and indirectly, leading to acute or chronic kidney. Acute or chronic. So when you take alcohol, it makes you dehydrated and you will not have volume in your body inside the vessels. Vessels, I mean artery and veins, because now you are dehydrated. Alcohol is a diuretic. I'll talk to you about diuretics when I'm going to drugs. Inhibits antidiuretic hormone ADH. Antidiuretic hormone is a hormone that makes you not to lose fluids, leads to increased urination causing dehydration, hypotension, reduced renal perfusion. And we said when your kidneys are not receiving enough blood volume, it leads to injury to the kidney because it suffers. And then oxidation. Alcohol metabolism increases reactive oxygen species, causing oxidative damage to renal tubules. The tubules that you have, the damages here, it leads to this because when they oxidize, they wear out. You get it? Oxidative stress leads to tubular dysfunction and injury. And then we talked about rhamnolysis, seen in alcohol intoxication and withdrawal symptoms. I've said rhamnolysis is destruction of muscles, breakdown of muscles, and then liver disease-related kidney injury, like hepatorenal syndrome, hepatorenal complication. You see, hypertension is there. You don't know have enough sodium, potassium, the electrolytes, they start being, and you see your heart relies on potassium. Alcoholic ketoacidosis is very bad for drinkers. You pile acids on your body. You get it? Now, this is the problems when it comes to alcohol. Stop smoking. We talked about smoking. Smoking. You remember our talk about smoking. Smoking is a very bad thing because you have seen it brings free radicals to your body, and the effects of free radicals is cancer. Smoking will not only give you cancer of the lungs, no. Free radicals in your body can give you a cancer anywhere. You get it? Listen to what I'm going to say. Smoking refers to inhalation of smoke from burning tobacco. It contains thousands of chemicals, many of which are toxic and carcinogenic. Carcinogenic means cancerous. You see that? So free radicals are carcinogenic, which are cancerous. You have talked about all, even smoking, and stress management. Now we go to drugs. Drugs is very important. Now we have said this very slowly and clearly. In this way, when you want to give drugs for hypertension, you say A, B, C, D. A, B, C, D. Where is my... When we were learning in primary school and childhood, we learned about A, B, C, D. A, B, C, D. A, B, C, D. So what does A, B, C, D means? Now that we saw when the sympathetic nervous system is activated, the first thing that is produced is renin. And renin does not cause constriction. It has to be converted into angiotensinogen. So we have to have a drug which stops renin or angiotensinogen to be converted to renin to convert the sorry. We have to get a drug to stop the enzyme that converts angiotensin 1 to angiotensin 2. You see that? Renin converts angiotensinogen to angiotensin 1. So we don't want angiotensin 2 because angiotensin 2 will activate aldosterone. So what do? We have angiotensinogen converting enzyme inhibitor. To inhibit is to stop. Angiotensinogen enzyme inhibitor. This one, angiotensinogen converting enzyme inhibitor. The key word here is inhibitor. Inhibit. This is a drug. This is a drug that will inhibit this enzyme from production so that it can stop angiotensin 1 to be converted to angiotensin 2, so that we stop the constriction of the muscles and we stop the production of aldosterone in your brain, so that the muscles can, the blood vessels cannot constrict. This one, these drugs, if you have ever gone to a doctor's office and then you are given a drug like enalapril, lisinopril, ramipril, anything that is called piril, lapiril, enalapril, lisinopril, that is the work of that drug. It stops the conversion, this enzyme from converting angiotensin 1 to 2, so that we don't get the veins to constrict. And then we have angiotensin 2 receptor blocker. Angiotensin 2 receptor blocker. Losartan, valsartan. So when we have already, it has already gone to angiotensin 2, and we are waiting now the aldosterone to be released, and sympathetic nervous system has already done. We can block the angiotensin 2 from working by blocking where it is going to activate. That is where we use angiotensin 2 receptor block. You see, so we can break that communication by using these two drugs. But there are some other drugs called beta blocker. Beta blockers are drugs that work direct on the cells of the heart. Your cells, there's like a tenorol. That's why I said today is ABCD, beta blocker. Beta blocker. We are at B, beta blocker. What do these drugs do? They stop the beta cells from working so hard. They reduce, decrease heart rate and cardiac output by blocking the cells. Beta androgenic receptors also reduce renin release. So they even reduce the release of renin from the kidney, so that it cannot start that activation of angiotensinogen. And then we have calcium channel blockers. These ones, they work in your veins. They inhibit calcium influx in the vascular smooth muscles myocardium, causing vasodilation. So you see, if calcium does not come in your veins, they will not constrict. So if you have ever gone to a doctor and you are given something called nifedipine, amlodipine, those are what blocks those channels, so that your vessels, your veins, where are my veins? These are my veins. So that your veins, this is your heart, cannot receive calcium, so that they can constrict. You get it? Hey, welcome, Roger Killer. Welcome to the platform. Thanks a lot. We have gone so far. You will rewatch so that you know. So when calcium, for these veins to constrict, we need calcium. But calcium channel blockers will stop it, the calcium from working, and your veins will not constrict, so your pressures will be normal because the veins will be wide. Hmm? Nifedipine, amlodipine, if you are ever given those drugs. And then we have diuretics. The last one, diuretics. Hmm? Diuretics, like furosemide, and then we have spironolactone. Spironolactone is potassium sparing. So you see, we are continuing very well. If someone is not understanding, please ask. Now, calcium channel blockers, we have said, these are drugs that stop calcium channels from receiving channels calcium in your blood vessels so that they can constrict. So when the sympathetic nervous system has already taken in whatever it can take in, what happens? The calcium is blocked, so your veins will not constrict. So your pressures will be normal. Diuretics promote sodium and water excretion. Oh, Lasix. Lasix is furosemide. Doreen Small. Lasix is furosemide. It's a diuretic. It's this one. Diuretic. This one. A, B, C, D. Lasix. Furosemide. Another name for furosemide is Lasix. What it does this. Promote sodium and water excretion, decrease plasma volume and peripheral resistance. So this is what Lasix do is this. These are our yes, Doreen, very nice. At least you know this thing. This is our veins. We have seen the sympathetic nervous system inside will have sodium so that water can come in. But when you take Lasix, they open these channels of the veins. So what happens? More sodium goes out. More sodium goes out. But you see, diuretics are two types. There is one called potassium sparing, which is very nice because when you use Lasix, or we call the other name furosemide, it takes everything away. It takes sodium, it takes potassium away, you urinate, which is dangerous at times because your heart needs potassium to work at times. And you see, you will run something called hypokalemia. So for people who are this way, they lose a lot of potassium. What do we give? We give potassium sparing diuretic, like spironolactone. You see, so those are things that we use. If you have ever had a person with these drugs, you cannot just give a drug. You look at the kind of hypertension that this person is having. The kidneys are working well. You have done your kidney function, the kidneys are working well, but the pressures are still high. This is now how to give drugs, and the pressures are still high. You think of vascular resistance. Vascular resistance means you think of the blood vessels. It's time now you think of the blood vessels. Now, we will not give angiotensin converting enzyme inhibitor and the kidneys are working so well. It will not work. If this person has vasodilation and vasoconstriction issues, this person has vasoconstriction issues, you give a drug that will work to vasoconstriction. So which one is the best drug here? We give nifedipine, which is a calcium channel blocker, so that in our blood vessels, the arteries and the veins, It can block the calcium from working so that we cannot get the vasoconstriction. You give that. Or you can add a beta blocker, because beta blocker, at times they work even to the vessels. So you will have dealt with this person first hand. You have met this person, you've seen this is a genetic problem, you cannot do more. You give this person that drug. The blood pressure of this person will be normal. You get it? Thanks, Roger Killer. Thanks. Now, you have a person, you see this person is having palpitations. Sometimes this person is having chest pains. You have done your kidney functions, they are okay. Will you give ACEIs, angiotensin converting enzyme, or angiotensin, the other one, like losartan? Losartan, I know very many people have been given losartan, angiotensin 2 receptor blocker. No, it will not work. You give diuretic and beta blocker. Why? Because the heart muscles have the problem. You are having arrhythmias, that's why you have chest pain. You give a beta blocker like atenolol, and then you give a diuretic to release more fluids from the body, from the circulation. This person will be okay. You get it? But now, if you give a calcium channel blocker to this person, it will not work. That is how we look at a person and we identify how to give antihypertensives. We don't just give antihypertensive, we have to do the required laboratory, and the laboratory findings are investigations are very important. Laboratory investigation. Don't be afraid of asking your patient to do these investigations, because they will guide you, or don't be afraid of doing them in the hospital, because they are guiding the doctor on how to treat you. You get it? Now, if it is blood related, what do? You check the blood, the fluid of the blood, the percentage of sodium, potassium, chloride ions, and creatinine, so that you may know how the kidney is functioning. If all of them are okay and this person is having high pressures, what else can you do? You can do an echocardiogram to find out how the heart is working. If you find any defect on an echocardiogram, that is where now you come with atenolol, beta blockers. Diuretics are universal when it comes to blood pressure, and diuretics are not just given to blood pressure. I want everyone to understand. There are some people who have pitting edema. When women are pregnant, their legs swell. Sometimes you may have normal pressures, but you have electrolyte imbalance leading you to your sodium uptake is so high, and you are having puffy face, your legs are swollen. We give you diuretics. So these drugs are not only used to hypertension. You may find something like propranolol, a beta blocker, is given to people that have anxiety issues, to make them calm down, to have a stable mood. You get it? There is one other test in the laboratory which is very important. It's called lipid profile, cholesterol, triglycerides, and you will see there are four types of tests in that lipid profile. One is called high density lipoprotein. Two is called low density lipoprotein. Three is triglyceride. Four, total cholesterol. After you've come from the laboratory, a doctor looked at them and then he says, okay, okay, I see you have a problem with cholesterols. Your blood is thick and you have sedimentations. This person is treated by statins to enhance breakdown of the cholesterol and elimination of the cholesterols in your bloodstream. Also, he's treated by antihypertensives because when the cholesterols have piled in your system, in your blood vessels, the release of something called nitric oxide will not be okay, because nitric oxide is a vasodilator. So it will not be okay. You have to be given an antihypertensive like nifedipine to stop the calcium from coming in when sympathetic nervous system activates, so that your vessels cannot constrict. But as you go on by taking statins, these are drugs that are taken for like months, your cholesterol levels goes down, you are advised on nutrition, you start living taking these drugs. You see how we manage. Please like and share the video. It's very important. I really like to help some people outside there who are struggling to get this information. Hmm? There are some microbiological tests like urine, culture, sputum, stool. I will soon talk about rheumatism, arthritis, SLE, systemic lupus erythematosus. Those are things I will talk about so that people will know how these things work. And I think the next topic should be on arthritis, rheumatic arthritis, and rheumatology, rheumatism, so that you can know how this brings pressure, because this person will not give him or her if a person has arthritis, there are some drugs that are of hypertension will not give, and you see, you really need to bring down the pressure. At least today we have known how to manage someone with these problems. There are some infections that can make you have high blood pressure, septicemia, malaria. When you are having compensatory mechanism in your body and it's fighting against these pathogens, and your heart is beating so fast, we call it tachycardia. When your heart is beating so fast, we call it tachycardia. When it's beating so slow, we call it bradycardia, low. Now, if you have a question, please continue asking, because I'm just about to finish about hypertension and management. I've talked about how from the mental institution to the physical institution, how they relate. I'm very sure if someone goes through this video, he'll now know how mental issues affect physical issues. There are some tests that we do to see how the kidney works, like urinalysis. If you do a urine analysis, it's a strip we dip. When we do them, we found that proteins are in urine. We get to know the kidney is injured. Glucose in urine, we get to know the kidney is injured. Stool tests, they can, but with this is for stool, is when someone is having parasite infection in the stomach. Fat globules, hormones and endocrine tests like thyroid stimulating hormone T3 and T4. They can make your blood go up. Insulin, I've talked about insulin in diabetes. Cortisol hormone, adrenal in Addison's disease. We have talked about it. Testosterone. And then tumor markers in cancer. I will talk Cancer will take 1 week. The topic of cancer that is coming will take 1 week, and you'll see how it comes up with hypertension and ends up with low pressure. And it's a mental, because the last part of cancer, we are going to talk about palliative management, which is very important in life. Hmm? So, my friends, thank you so much coming. I think I have managed a patient with hypertension well. Hmm? Yes, I will. I will. I usually during small. I usually put it up before uh, 6 hours when it starts, so you will get a notification. I think I've managed the patient with hypertension well, right from the mental issues to the drugs. I thank everyone that has been on platform and asking Doreen Small, Roger Kila, Isi Maje, and all that have been here. Those that have commented and asked questions. Tomorrow is on Saturday. We are just having a recap. The next topic will come on Monday. So tomorrow I'll be talking about general issues that we have talked about. And on Saturday is when you have a burning question, you bring it up, we discuss. Enjoy your weekend, and God bless you so much for your support. Have a nice evening. Be blessed always. Thank you so much.